Welcome to the We're Good podcast, where we are celebrating the everyday brilliance of people working toward a more positive world. If you're looking for the good that's taking place around you, you've come to the right place. Imagine if one conversation, one screening, one moment of action could give you more time with the people you love.
My mother was diagnosed with breast cancer. It was supposedly early stage. She said, "Don't worry about me, I'm good."
On this episode of the We're Good podcast, we take you to the Inova Saville Cancer Screening and Prevention Center, where that kind of impact is happening every single day. Today, in part one of this series, you'll hear two stories from an oncologist and a genetics counselor who have a common bond that makes fighting cancer a mission. Listen in and learn more about the screenings, prevention, and treatments that are saving lives today on the We're Good podcast. Welcome back to the We're Good podcast. I'm Leanne Necessary Brownlee, your host, and we are very excited today to be back out on location, this time at this amazing facility here at Inova, the Inova Saville Cancer Screening and Prevention Center. And joining me today are two women who are on the forefront of cancer prevention and screening. We are so happy to be here. Dr. Rebecca Coleman, who is the executive director here of the Saville Center, also an oncologist with a vast experience. And we just appreciate your time. You are so busy, and thank you so much for joining us today. And Liz Stark, who is a certified genetics counselor, but also the director of community health here at Saville Center. And just so thank you, also very busy. So thank you for taking the time to join us and talk about this wonderful foundation here.
Yeah, we're so excited.
Well, thank you. And just want to start off, first of all, Dr. Coleman, we have so much. We want to just tell people this is just the first of a two-part series because we have so much to talk about today about the Saville Center, but also the importance of cancer screening and prevention. Can you explain to me, you are on the forefront of getting this thing up and going here at Inova. Can you explain to me, we're sitting in this beautiful facility. What is going on here at the Saville Center?
So let me step back a little bit, if you don't mind.
Yeah.
So we opened the doors about 4 years ago, and it really was a novel concept. And we are very fortunate to have an incredible set of leadership and foundation support that saw a vision for the need for cancer screening and prevention, an actual dedicated center, because it's really rare. There are not many centers around the country like what we have. There are about 4 or 5. To have a concentrated focus on cancer screening and prevention. There are programs, but not necessarily where you actually do the screening and prevention. So anyway, that's some background. So what do we do? When we opened, it really was focused on just giving risk assessments to anybody who came in to tell them, okay, let's look at you. Let's look at your family history. Let's look at your exposures. Let's look at what you've been doing so far in terms of cancer screening and what is a personalized plan that would be best to serve you. We also felt like it was very important to look at the person, not just in terms of their risks, but in terms of their overall habits, their lifestyle. But because we know that 40% of cancers are preventable with lifestyle changes alone.
Say that statistic again.
Yeah.
So that's amazing.
40% of the cancers that we see are modifiable with lifestyle change. And that's the hardest thing for us to do, right? Like, we didn't want to, label somebody as having this issue, whether it's alcohol or whether it's diet or whatever, without providing the support for it. So before we started, offering any holistic services, we made sure that we actually had the assessment tools to assess what the needs were and then to provide support for that. So just to give you a little bit of that, and I'm going into a lot of detail about this, but we feel like it's really important. So we do in-body scans on everybody that comes in. Are you familiar with that?
Yes, but share with our audience.
Okay.
Yeah.
Most people will find it at their gyms, but it looks at body composition. And we find that if we address lifestyle change by looking at our own body composition rather than focusing on weight or BMI, it gives them some understanding about why we're looking at those things, why body composition can tell us if there are risk factors. So typically, if you have more body fat, it puts you at higher risk for about 13 different types of cancer. A lot of people think about weight as being associated with cardiac risk, but there's really a cancer risk associated with that. So we start out there. It's actually done on every first visit that we have. We just had them done on my patients this morning. And so if we identify that there's an issue, we also have the support to help manage it. We're not saying good luck, go fix these things. We have a dietitian that's free, and health coaching that's free, and we have access to a medical weight loss specialist as well. So,
Amazing.
yeah, and we have behavioral therapy for individuals who have, any other issues that are getting in the way of their health. So, anyway, that was a long way to say that, we are trying to do a holistic approach to risk assessment and to care.
Oh, but there's so much going on. I think you told it very concisely because, Liz, there is so much going on here. You were saying that you're looking at people individually, and that's relatively, as you said, rare.
Yeah, I think as a whole, we have this one size fits all approach. If you're this age, you should be doing this thing. But in Seville, our idea is let's look at genetics and family history. Like Dr. Cultman mentioned, let's look at your individual lifestyle choices. Let's look at your environmental exposures and really come up with a plan that fits those risk factors. So it's all about helping to make sure we have the right person on the right plan at the right time. You don't want to underscreen. We don't want to overscreen. We really want to help people figure out what their best path is.
That's amazing. And I want to do something. We do this with a lot of our guests. We talk about journeys and how you got here because that really helps our audience know. And I also think your why. Why are you here? And when we were talking earlier, I think all three of us found we had a common denominator, and it's perhaps not. It's a sad one, but we've all lost loved ones to cancer. And Dr. Coleman, starting with you, how can you go back a little bit to when you were in medical school, if you don't mind sharing your story?
Yeah, sure. So I was a third year in medical school, and in third year, at least back in the day, we did rotation. So I was on a rotation somewhere out of state, and learned that my mother was diagnosed with breast cancer. Um, it was supposedly early stage. She said, "Don't worry about me, I'm good." She started chemo. She had surgery, and radiation. And then during her radiation, about 4 weeks into it, she started noticing a change in her breath. And it turned out during the radiation, she was diagnosed with metastatic disease. And she died within 14 months of her diagnosis. So during my fourth year of medical school.
I am so sorry.
So, no, thank you. But, we talk about drivers. And if you'd asked me at the time, I was never going to go into oncology.
You were headed towards something else.
I was headed towards pediatrics actually initially, but I think what you find is, and one of the reasons why I went to medicine was for the personal connection. And, what I found was I kept gravitating back to the families that were dealing with a new diagnosis of cancer. So even my residency, when I did rotations, it was like those people that I felt most comfortable guiding. And so that led to fellowship in oncology and then focus on breast cancer because it's what I knew. So anyway, so I did that for 15 years, and it was amazing. Like it really, so as a breast oncologist, I treated women with chemotherapy and hormonal therapy, and really guided families through that process. And I found it incredibly rewarding. But when I was offered this opportunity, I'd always been doing a little bit of risk assessment as part of my practice in breast oncology. So I see women at higher risk for breast cancer. So it was always kind of part of my practice. But then I was offered this opportunity to do just solely prevention. And it really spoke to me at that point in my career that this is a way to move the needle, to really help educate as many people as possible what their risk is and what we can do to prevent it from even starting.
That's right. Prevention before it starts. I
Right.
mean, what a wonderful thing. And you are moving the needle. We are so glad that you are doing what you're doing
hope
here
so.
in Seville. Oh, yeah.
Yeah.
And of course, Liz, your story also similar as to why you went into genetics counseling.
Yeah, when I was in grad school for genetic counseling, kind of learning about the different fields, I went in with this mentality that I will do anything but cancer. Everyone I knew that had cancer died from it, and I didn't really want that to be my life. But when we started taking the courses and when I learned about cancer prevention, it's like an entire new world opened. It didn't occur to me that there were choices that we could make to help people rewrite their family histories so that the next generation doesn't have to look like the previous one. And that felt really empowering. So I started off doing cancer genetics and meeting with a lot of cancer patients, helping them figure out if there's something that they can use to help tailor their treatments and that sort of thing. But again, cancer prevention really caught my heart in helping people who may be nervous, maybe they're afraid, really understand all of the different pathways they can take to reduce their risk and hopefully prevent cancer altogether.
Mm. We do want to say with a caveat, there are people, of course, and you say this, that there are people that have a genetic background,
Yeah.
environmental. I lost my father to leukemia, and
Mhm.
so there is that. But what you're saying is that there is another percentage, and that is the focus on the ones that can be prevented.
Well, I would say even if you're at increased risk, it's
Mhm.
not your destiny.
Right.
So there
Right.
are things that we can do, even in women and men that are at highest risk for cancer, not only preventatively, but for early detection. And that's one of the things that we're working on here is to try to identify who the higher risk population is. We know the genetic risk group for sure, but are there others exposed to different environmental exposures, like firefighters we spoke about, and military personnel exposed to burn pits, where they need a different level of screening? So, we have only about 5 tools that are approved for screening in the US, but we know that there are many other cancers that can develop other than those 5 approved screening tests. So,
That's amazing. 5 are approved.
5. Mhm.
Wow.
Between men and women.
Wow.
Yeah, it's nothing, right?
Huh.
So we need to change that. So one of the things that we try to do, number one, is just increase the uptake of the cancer screening that we have. We know that even just doing that will move the needle to downstage a lot of the cancers that we see and pick them up earlier.
Right.
And then the next thing we're trying to do is change the types of cancer that we can detect early. Maybe the cancers that we know of as, you know, being hard to treat, or, I don't want to say death sentences, but really, high risk problematic tumors, um, might not be so if we catch them at an earlier stage. And so these blood tests and other tests that we're working on developing here and testing here could change all that. I think our vision of prevention and early detection is going to change a lot in the next decade because of the emerging technology.
And we discussed that too earlier was that you wrote a wonderful article on Pathfinder too.
Mm.
Can you explain just a little? I know it goes into great detail. We won't be able to, but
Yeah.
you're talking about the genetics testing, and there's a lot that's out there now that was not, and SHAR is taking place in the research. I know that there's always new research and new drugs developed all the time that can help with some of these things like that we're talking about.
Yeah. So let me just clarify, because this is something that we get questions about all the time.
Yeah.
When we talk about genetic testing, there are really 2 types. There's germline genetic testing, what you were born with. And that germline testing can tell you whether you have a mutation that puts you at higher risk for developing cancer. And that's what Liz's job did in her former role as a genetic counselor, focused on germline genetic testing to tell people, are you at higher risk for developing cancer? These newer tests that we're talking about are looking at cells in the blood, so active cancer cells in the blood, looking to see if we can detect cancer before it's even detectable, sometimes even on scans. So this is like aggressive cancers like pancreatic cancer, esophageal cancer, lung cancer, things that we were never able to detect very early. These blood tests have promised to detect these cancers at an earlier stage with one test, as opposed to sending for scan and this and that, right? So the Pathfinder study was looking at one of these types of tests. So it's called the Gallery test that Grail has developed. But there are a number of companies that are developing these tests, and they're called MCEDs, or multi-cancer detection tests, or multi-cancer early detection tests.
Okay.
So the Pathfinder study looked at one of these tests, enrolled women and men over 50 who hadn't had a cancer diagnosis in 3 years, and looked to see if they had active cancer in the blood. That study, we enrolled over 800 patients, but it was enrolled over 35,000 patients nationwide. And the results are being presented at ASCO in Chicago, the American Society of Clinical Oncology meeting in June. So, yeah, so very soon.
So stay tuned.
Stay tuned. Yes, a lot of exciting emerging data with that. And then, yeah, there are several other trials that we're involved in and that are ongoing throughout the country looking at these tests. That's why I really do believe that in the next 5 to 10 years, we are going to be seeing a very different landscape of screening.
That's good news. I love to hear that. I know anybody listening is going to love to hear that. But I do know that some people, Liz, we were talking, have the misconception that those tests are for people who can afford them. My insurance might not cover that, and they don't even go down that path. So can you speak to that?
Yeah, absolutely. I think that there's been a lot of changes in that space. And I think when we realize how cost effective prevention is, there are some good opportunities for people to take advantage. So there are a lot of financial aid opportunities, even from the genetic testing labs, so that the testing costs nothing out of pocket. A lot of insurance companies are starting to cover it with specific family histories, or even the self-pay price for some of the tests we do is $249, and most people are paying much less than that. So I think it used to be $4,000 for 2 genes when we started,
Right.
but now we're looking at 77 genes for much less, and really have some great pathways to help people figure out how to get those covered if it's indicated.
Also good news, right? Good
Yeah.
news on that front as well. The other thing is that we do talk about the testing or what we see. We have so much coming at us on our social media feeds.
Yes.
And I mean, I'm talking with, my own children or with relatives, but it's good to be aware,
Yes.
but how do you decipher that?
I mean, there's always cancer in the news. It's a hot topic, obviously, because so many people are affected by it, right? So,
Right.
and we want to know more. We want to learn more. But as Liz said, we also don't want to over-test and over-screen for people that may not be at increased risk. So if anyone ever has questions, they should be asking their doctor. I really think that risk assessment should start earlier than what we do now. So we are part of that process of trying to educate primary care doctors, OBGYNs, about doing an early risk assessment. I'm not saying in your teens, but like around age 30 is probably a good starting point to start talking about family history, your lifestyle habits, other things that could, suggest that you might be at increased risk. And then, we do see that there's a trend towards earlier onset cancers developing in younger individuals.
That's just been in the news.
Yeah.
Colorectal cancer
Right.
in their 20s.
Yeah. Yeah. So
Yes.
we do see some of that. And, because science takes a while, we're always a little bit behind that. So what I would say is we don't know exactly what's causing it. It could be a combination of environmental factors or diets, et cetera. But the best thing to do is to be proactive and to talk to your physicians about what you could be doing, your providers of what you could be doing to help minimize your risk. We know that alcohol is a carcinogen. It actually increases risk. Minimizing the things. I'm not saying to have no fun. I'm not supposed to be the buzzkill for everybody, but to do it in moderation and to keep in mind that those effects early in life can have a later effect, as you go along and as you age. So getting into good habits with exercise is a really important thing that we all need. And trying to eat as much unprocessed food as possible. Is probably a good lesson to learn early on.
Early on.
Yeah.
That's right. As far as here at the Saville Center, Liz, who are you serving? If you could share with our audience, who are you seeing as the general population?
Yeah, I think there's a couple different groups. So we see people who have a family history of cancer who are concerned about that to again take a step back and look at the whole picture because genetics is just one piece. So certainly people are coming in their way. We know that there are certain occupations of people who have higher risk of developing cancer, whether those are our firefighters, our military members with burn pit exposure. So trying to help, figure out what increased risk those individuals may have. But we also have some people that are just wondering, what is my risk? They don't know where to start. And I think one of the really unique things about Saville is that we're helping people put that framework into place. And that can also cascade through the generations. When your kids see you eating a healthy diet and exercising, those are patterns that you're passing down and showing them. We also help people really figure out once we have the plan, how do you put that into action? There's one thing for us to tell someone, hey, this is what you need to do, but what helps them actually take that next step? So we have our own behavioral health therapist on staff, and she runs a workshop called Scanxiety because sometimes it can be anxiety provoking just to think about taking that next step.
Oh, yeah.
Yeah. So we're really trying to help people address their health from every angle. And if there's a barrier, we're here to help you figure out how to overcome it.
We're going to talk a little bit about barriers coming up in the second part of this, but um, also when you say scanxiety,
Yeah.
what does that come from? Can you tell me more about what you hear from people?
Yeah, I think anytime that you have experienced a loved one with cancer, you know that that next scan can sometimes just raise your blood pressure, even thinking about it. And it's not even just the scan, it's waiting for those results to come back. And sometimes that fear can be so much that you might put it off. You might just feel easier to avoid it or to not do it. And so, Alana, our behavioral health therapist, has put together a really wonderful program to help people address those concerns that come up and really approach it in a more productive manner so that hopefully people are able to stay. Because when we do our plans, when we do everything that Dr. Kaltman's setting forth and we do it on time, early detection makes a difference. And the opportunities you have are just much greater for a great outcome.
So all of these are important things to know. We have just kind of done the tip of the iceberg on what is going on here. And we really want to talk about an exciting new thing that's just happened in the past year, which is the bus. And that is a bus that is really going to help access for so many people with healthcare. And it goes out and beyond this amazing center. So we're going to talk about that in our part 2, but we thank you both for being with us and getting us started with a very important conversation. Thank you so much. We're going to have you stay with us because we are going to be coming back. Of course, we're wrapping up this first episode, but we want you to be sure and share what you've learned today because, Liz, we have a very important screening fair that's coming up. You want to tell us about that right now?
Yeah, absolutely. So on May 16th here at SHAR, we're going to be hosting a community health fair from 9:30 to 1:30. And it's a great opportunity to come and learn about cancer prevention, to learn about all of the things you can do to make a difference. And we'll also have free screenings available. So skin screenings, PSA for prostate cancer. We're going to have fit kits for colon cancer risk. Even cardiovascular risk. There's a ton going on. So we encourage everyone, bring the whole family. We've got kids activities, cooking demonstrations. It's going to be a great time.
Sounds wonderful. So that is Saturday, May 16th, here at Inova.
Correct.
At the SHAR Center. All right. Well, we'll be telling you more about that, and we'll go more into that in the second part of this wonderful episode. Like we said, be sure to share this episode with someone you love because, as we like to say, we're good and you're good, and we can all make a difference.